good day everyone. I'm Garrison, your moderator for this webinar on the behalf of the organizer company called Conference Panel. I welcome everyone for today's webinar, which is called Path Physician at Teaching Hospital 2022 Medicare Updates. So now I would like to introduce our presenter for today, Tony L. Holmes. Tony L. Holmes is CCS, CPC, CPMA, CRC, IMA approved ICD-10 and PSC trainer. PSC trainer is an internationally known speaker and recognized subject matter expert on medical coding, reimbursement, and revenue cycle management. She is the founder and CEO of Alpha Coding Expert LLC. So now I would like to hand over the floor back to our speaker. Over to you, Tony.
Thank you so much, Garrison, and thank you to all of our attendees today. So we're going to be talking all about PATH, Physicians at Teaching Hospitals, specifically the 2022 update. So first and foremost, we're going to be talking a bit about some key terms and regulations. I think it's important for all attendees to be on the same page when I use certain language, which terms I'm talking about. So we'll do a little bit of background, and then we'll jump into the primary care exception rule. So quite a bit of changes during the public health emergency, as well as updates to evaluation and management, coding, and leveling. So we'll talk about those updates, specifically the 2020-21 E&M guideline changes and how those specifically affect teaching settings, and then we'll talk about the considerations specifically for the public health emergency. So we continue to be in a PHE, and while we're in this PHE, there are going to be some rules and some flexibilities specific to PATH that you want to be aware of, and you'll also want to be aware of things that once this PHE goes away will go back into effect. Lastly, we'll be talking about some specific pro tips that will be helpful to you if you work in a PATH setting. So some key terms we want to focus on when we're talking about PATH. So these are specific to either teaching hospitals or teaching settings. So basically, Medicare subsidizes with federal money hospitals to train residents. And when you receive money from the government, there are regulations and rules that have to be followed in order to comply with the program requirement for ACGME, which we'll talk about in a minute, but also reimbursement requirement from CMS. So PATH, again, everybody probably knows what that stands for. Medicare specifically has rules for how these things are billed, how these things are documented when there's the collaborative service rendering between the resident and the attending. So teaching hospitals get that special money. They're subsidized by the government to train residents, which means Medicare has the right to say you have to have certain documentation, you have to meet certain guidelines to qualify for a teaching program reimbursement. So highly, highly regulated, high audit target. So teaching physician documentation combined with the resident's documentation can be used for billing purposes. Again, the teaching physician is expected to review and sign off on the resident's documentation. So anything that the resident is putting out has been screened and signed off by the teaching physician. So the guidelines apply to care provided by interns, residents, fellows, all of the umbrella terms for residents. All right, so primary care exception. So there is a special exception for the teaching physician PATH settings, and it's called the PCE. Basically, primary care center is an area located in an outpatient department of a hospital or in an ambulatory care setting where time spent by residents in patient care is a part of the GME payment calculation. So this is very common in primary care, so family practice, internal med, geriatrics, pediatrics, and OBGYN. Those are typically the specialties that would qualify for a primary care exception rule. These are going to be typically attached to the hospital or very close to the hospital, and residents are going to see patients more independently and have more flexibility on which services they can provide independently. So we'll talk about that. So the E&M coding methodology. So this is super, super important because this methodology changed last year, and the providers that I've worked with and organizations that I've worked with have really struggled with the implementation of these guidelines, because if you've got providers that are seeing patients across multiple care settings, it can be especially challenging. So if you've got residents that are seeing patients in the hospital, they're also seeing patients in the clinic. They've got to juggle multiple sets of guidelines, multiple sets of leveling methodologies, and not just residents, physicians, attendings, anybody that's utilizing and reporting these E&M codes. It's very, very difficult to keep them all straight. So in 2021, for office and outpatient E&M services, the leveling methodology changed. We'll briefly talk about that. So with that kind of in mind, let's talk a little bit about the 2021 E&M guidelines and how this affects PATH. So with 2021 E&M guidelines, we had all of this terminology that was redefined by CPT. So CPT basically came out with their own definitions of what a problem is, what a problem addressed is, what a self-limited problem is, stable chronic illness. So I would highly encourage you to read through these, because these are going to be the foundation for how you're picking the categories of medical decision making. So some key modifiers that you definitely want to have on your radar, we talked about these. So the GC modifier is going to be the modifier that represents that part of the service was done under the direction of an attending. And then the GE modifier is going to represent that the service was rendered by the resident and the attending was not part of the service and not directly provide the service under the primary care exception rule. So now let's talk about the exception. So during the PHE, so during the public health emergency that we're still under, PATH, so teaching hospitals, teaching physicians are permitted to use virtual supervision for residents. During the PHE, we've also seen an expansion of services that can be provided in rural health settings, and also we've seen expansion of what residents can provide in the primary care setting under the primary care exception rule. So Medicare is reimbursing temporarily for residency services for all E&M levels provided under the PCE without the attending present. Thank you so much to all of our attendees today. I really appreciate your time and attention. It's been a lot of fun talking about PATH. I hope that this has been helpful to you. If you think of any questions or have any thoughts, please feel free to reach out to conference panel and they'll be sure to connect you with me. So have a wonderful day and take care.